A very good afternoon to all the viewers. Greetings from Varam. This is a dedicated specialty center at MGM, addressing all the needs of the women. I'm Dr. Lavanya E, Associate Consultant in association with MGM. I'm here to present and address all your basic questions that arises once you become pregnant. So my topic for today is the do's and don'ts while you're pregnant, starting from your conception till your mid-trimester. As soon as the women get pregnant, so many questions arises out of family members, the husband. So I'm here to address all these things. So once you get pregnant, the first thing you should consult with your obstetrician and gynecologist. So you book an appointment with them, and during the appointment session, your basic parameters will be checked. That is your height, your weight, and your BMI will be calculated. Your blood pressure will be checked, and a brief history about yourself and your family history. All these will be taken. So we have an idea of what you are now. The first question every woman has is, how many weeks or months am I pregnant now? Because my cycles are not regular. So I'm very worried whether I've been late to this appointment. So the answer to this is, if your cycles are regular, say 28 to 35 days, then very well we can calculate from your last period state. But if your cycles are irregular, then we got to do a scan for you, and depending on the scan findings, we will let you know how many weeks you're pregnant. So you need not worry about that. The second thing, what are the things that you need not worry during your pregnancy, that is in the first 3 months of your pregnancy? So first is, everyone will experience this vomiting and the sensation to vomit. So if you have vomiting like 2 to 3 episodes per day, you absolutely need not worry about that. You can very well take the antiepileptics that's being prescribed to you by your doctor. So these are safe drugs during pregnancy, and don't be carried away when someone says you're not supposed to take any drug while you're pregnant. So these are approved by the government and can be taken during your pregnancy. The second most common thing is, doctor, I'm using the restroom very frequently. I'm not like this before. So you should understand, when you're pregnant, your uterus is going to grow in size, and this is not going to allow space for your bladder to distend. So using the restroom very frequent, that is normal for a pregnant mother. Don't worry about that. The third question comes is, I'm not passing stools at all. It's been like 2 days or 3 days, and it's really worrisome to me. So, say in pregnancy, a hormone called progesterone is increased, and definitely it's going to have some effect on your bowel movement as well. So, constipation for a day or two, that's okay. But if you're constipating for so many days, then definitely you've got to consult with us. And the next thing is, some may experience mild crampy pain while you're pregnant. Don't worry about that when you have some pain, because your uterus is going to stretch during the first 3 months. And sometimes that movement can cause a little bit of abdominal pain. So don't worry about that. The next is, you might experience a little bit of brownish discharge or a minimal spotting during your first 3 months. That is because all the blood flow is increased while you're pregnant. So you may have a little bit of brownish discharge, and that's normal. But if it's bothering you so much, definitely you got to consult with us. So moving on to the next thing. So what are the things that really you need to worry? The first and foremost is the hyperemesis. That is, you puke out everything you have in a day. Some vomiting 2 to 3 episodes is okay, but if you're having like very frequent 5 to 6 episodes and it's making you get tired all the day, definitely you got to approach us. Already you will be prescribed some antiemetics, that is some oral medications. But apart from that, we need to assess you, and we need to know whether you need admission and additional supplementation as parenteral injection is needed or not. So all these will be done by us. But the only thing, you have to seek us at the first go itself. And the next one is severe abdominal pain, especially when you have fresh vaginal bleeding also associated with it. The most common thing is, when your baby is formed, sometimes it tends to stay back in the tubes itself. It doesn't descend to the uterus. So this is called ectopic pregnancy. So as it distends and grows inside the tubes, you're going to experience pain. And the second most common reason is there may be a slight fall of your hormone named progesterone. So once your progesterone level comes down, the uterus will not be able to hold your baby. So it's going to contract and it's going to expel, it will try to expel your baby and tend to miscarry this pregnancy. So when you have abdominal pain that is persisting for some time and associated with the flesh bleeding, definitely you got to come to us immediately. But I could say one thing: it's not that all bleeding, all vaginal bleeding is being miscarried. There are some patients whom we have witnessed, even after they experience this bleeding, we have seen a good cardiac activity, a good baby inside the uterus. So don't always be carried away that once you get the fresh bleeding that you have aborted, and don't say that you have aborted immediately. Okay, that is the one thing. The next one is the burning maturation. Passing urine frequently, that's fine. But if you're having burning sensation while you pass urine, definitely you've got to rule out any infection in your urinary tract and you've got to get treated for that. The next most common topic asked, not only by the mother, her husband, her in-laws, everyone, is what food can I give her now? Everyone is like wanting to dump the mother with food, make sure that she gets adequate nutrient because she's now carrying a baby with her. You should have in mind, getting pregnant doesn't mean that you have to eat for two people. It's like just a minimal of 300 calories extra that you need when you're carrying your baby. So don't dump too much of food into yourself. So the basic theme is you cannot definitely have 3 meals a day. So you've got to split up your meals into 6 times a day. That is 2 meals in the breakfast for your breakfast, and 2 meals for your lunch, and 2 meals for your dinner. So this will help you to have a balanced diet as well as this will make sure that you have a good food for the day. And always per day, you just have it in mind. Just try to eat at least 2 different varieties of fruits and 2 different varieties of vegetables. This has to be a component in your meal. And so, what are the fruits that I can have? That is the most common question. So you can have pomegranate, melon, pure fruits, kiwi, all these are good, and you can have it. And vegetables, all kinds of vegetables are good. Definitely you can go for it. But some may prefer like only one particular vegetable or one particular fruit I'm comfortable with. So I want to have that all the day, all the month. It's not like that. See, certain fruits will have certain vitamins in high amounts, certain vitamins in low amounts, which is going to be compensated by the other kind of fruits. So don't stick to only one particular fruit and think that you're having a good diet by eating that every day. So you should mix up your diet as well. And if you're a non-vegetarian, you can take fish and chicken. But the only thing is, in fish, you cannot have the big fish like the king mackerel, swordfish, or shark because these contain very high quantity of mercury in it, and that is not safe for your baby. So try to have only small fish. If you're very fond of big fish like mushroom, you can have it maybe once a month, but not very often. Okay? And yeah, what are the foods that you need to avoid, especially during pregnancy? I know most of them are very fond of having coffee, tea, chocolates, but definitely a no to all these things. Because a component called caffeine that is present in large amounts in coffee, chocolates, and to an extent in tea as well, apart from tannins. So what this do is, when you consume a coffee and after that you're going to have your meal, this is not going to allow any nutrition to be absorbed into your body. And as well, this when it passes to the baby, it's going to hyperstimulate the baby and cause some neurodevelopmental problems later on. So that is not at all good for your baby. But say some people say if I stop drinking coffee or tea, I'm going to have headache. I'm not going to feel good the whole day. Then okay, maybe you can take it, but you should restrict yourself to only maximum of 2 cups of coffee per day. That is the caffeine component of about 200 milligrams per day. That is the maximum permissible for you during your pregnancy. So the next food I want to talk is about the fruits. It's mainly the papaya and the pineapple. These two are known to cause stimulation of your uterus and miscarriage your pregnancy. So it's better that you avoid it. And obviously, no for all the junk foods and no for all these oily and spicy foods because already you'll be vomiting and it's going to increase your acidity. So you can't have all those. And in non-vegetarian, like raw egg cannot be taken during pregnancy and all undercooked meat because sometimes it may cause food poisoning and also a particular organism called listeria. It's present in all these undercooked meat. So that might lead to listeriosis, which is not good for you. So these are the basic foods that you've got to avoid while you're pregnant. After food comes the exercise. So if you're a very active person, say you work out in the gym every day and you do cycling, walking, swimming, and you do dancing, all these things you can carry out even while you're pregnant. But you should make sure that you don't do a strenuous exercise that causes increased pressure on your abdomen and no jumping or bouncing exercises. You can always consult this with us. But some patients say they wanted to start for the first time when they're pregnant. You can always get back to us. We will advise you on what exercises you can do while you're pregnant. And generally, you should remember you cannot go for like a full exercise schedule on the first day itself. You have to gradually increase slowly from like say 10 to 15 minutes, and then you gradually increase to half an hour. And in all your exercise schedule, you should have like the initial 5 minutes of warm up session, then you do your exercise, then you do your strengthening exercises, followed by your stretching exercise so that you do not have that muscle cramps after you finish your exercise. So, this is about exercise. The next thing is about sleep. Make sure you get adequate sleep while you're pregnant, especially at night when you sleep. You should sleep on your back, not on your abdomen. And it's good that if you could sleep on either side, preferably on the left side, because that's going to improve your digestion also as well. So this is about sleep. Then the most frequently asked is about travel, whether I can travel now. Uh, you can use any mode of vehicle for travel, but you cannot do frequent long distance travel. That is definitely not advisable. But there is no restriction for travel as such. The next thing is, what are the supplements you must take during the first 3 months? Definitely, you will be prescribed folic acid by a doctor. It's usually taken in doses of 400 micrograms per day. But if your pregnancy is at high risk, say like you have a previous history of puberty defects, you're diabetic, so you're obese, in certain patients, we will prescribe 5 milligrams of folic acid per day. So that will be done by your consulting doctors. Apart from this, you will be prescribed zinc and vitamin C as well. The next thing is stress. That is the most important when you're pregnant. Working women may face stress at home, stress at workplace, so everyone should can have this. So you should always remember you are the only person who's responsible for your baby, and you can't afford to take all these by yourself. So always make your partner sit next to you, discuss with him whatever you feel like not comfortable with, and address all your issues. And don't think you can handle all that all by yourself. Make sure you read some good books, you listen to some good music, and you do some good things when you wake up in the morning. And don't read some newspaper which features some accidents or such kind of negative news. So always be calm and stay happy throughout the day, and make sure that your baby is also happy. Only when you can be happy. So the next thing is about weight gain. Uh, the first 3 months, usually people may tend to vomit a lot. So they might not even gain weight at all, or they might even lose weight. But don't worry about that. After that, your appetite is going to increase, and you can always put on weight even after the third month of your pregnancy. So don't be worried when people say you have not put on weight during this pregnancy. The next one, that is the most hesitant topic that everyone is really scared to ask. That is about the intercourse. See, there are every book says that you can definitely have intercourse while you're pregnant, but make sure if your pregnancy is as high risk, say you have a previous history of cervical incompetence, previous miscarriages, or now your pregnancy is a twin gestation, it's better that you refrain from intercourse. So always make your partner understand of what you're going through, and definitely he's going to help you out with that. Especially if you have any pain or discomfort after your intercourse, it's better that you refrain from that. So after this, so what are the tests you will do once you get pregnant? So basic hemoglobin will be checked and look for whether you're anemic or not. Then your blood grouping and typing will be done. Then you will be screened for some viral markers, say HIV, hepatitis B, apart from that, VDRL. And your thyroid profile will be checked. Then a basic urine test will be done to look for any undiagnosed urinary infection. So these are the basic tests. And moving on to the scan, the first scan will be done by 7 weeks of your pregnancy. That is called the dating scan. So what you're looking for in it, the dating scan, first we will get to know your expected date of delivery. Especially if you have irregular cycles, you'll be able to time your delivery. And we will look for whether it's a single fetus or it's a twin gestation, whether the cardiac activity has been established, whether the formed fetus is within the uterus or it's lying somewhere outside the uterus. So these things will be checked during your dating scan. After this, the second scan is your NT scan. So that is usually done between 11 to 13 weeks of gestation. So this NT scan is a measurement of your baby's fetal neck tissue behind the back. So once you get the measurement, along with that we do a blood test that is called the double markers or the dual markers. So here we're going to measure two hormones, that is the PAPPA and the HCG. So once we get the value of these two hormones, along with that, the interpretation of the NT scan, the sonologist will give us a risk assessment score. So with this score, we will be able to screen for genetic syndromes, not all, specifically the Down syndrome, that is trisomy 21. It's just carrying the extra chromosome, more than two letters. So this syndrome is mainly screened because once you test at high risk for Down syndrome, your baby is going to have mental retardation, delay in all the milestones, developmental delay. So this is so important that you get it done and you don't miss it in the third month. Okay, so these are the basic things that been questioned during the first 3 months of pregnancy. Moving on to the second trimester, that is starting from your 14 weeks till your 28 weeks of pregnancy. This is called the honeymoon period of pregnancy. Why so? Because all the symptoms you had so far, say your vomiting, your mental stress, everything is going to subside during this period. And your appetite is also going to increase, so you will have a good food intake now in this trimester. So, what are the things that you need to worry during this trimester? The first thing is they're worried that their tummy is not seen during the second trimester. They say, Doctor, I've been into the fourth month, but still my tummy is not seen. Everyone is asking me whether I'm pregnant only. So, what I should do? You should remember, since the uterus is a very small organ, it's going to stay within your pelvis for the first 3 months. Only after that, it's going to grow outside your pelvis. So you got to wait for some time to be seen. So don't worry about that. The second thing is, I haven't perceived my baby movements on till now. But should I really worry about that? So addressing that thing, if you're pregnant for the first time, you're going to perceive your baby movements only from 18 to 20 weeks of gestation. And it's not going to be a very vigorous movement. It's just like a flutter, like how a butterfly will touch and go. It's only that sensation that you're going to perceive. But if you are a working woman who works all the day and only get to sleep at night, then probably a little bit delayed it will be for you. But you should concentrate still your baby movements. And preferably Not only like after every meal, you can spend a half an hour to 1 hour time to concentrate for the second time. Obviously, you know everything now, so you'll be perceiving it even a little bit earlier. Then some contractions might be felt during the second trimester, which we call it as Braxton Hicks contractions. Don't get worried about the name. These all are some false labor pains that come during the second trimester. These are very less frequent and it usually means out. So don't worry about the contractions. The second thing is some might face dental issues because overall your blood flow is increased during your pregnancy. And while you brush your teeth, some may have bleeding gums. That is normal for a pregnant patient. But if you feel that is bothering you so much, then definitely you've got to get an appointment with your dentist. The other thing is the most worrisome is the stretch marks. Oh, I'm having now itself the stretch marks. See, as the uterus is going to grow, it's going to stretch your skin as well. And it's going to cause a breakage in the elastic fibers of your skin. That is normal for a pregnancy. But if you're so much worried about the stretch marks, then you can apply some moisturizer or any silicone gel formulations. So you can get this consulted with us. So that is the pregnancy marks. So you got to enjoy about that more than worried. And the other thing is, some may say, Doctor, I've gone so dark, my skin are just so dark, and I'm getting pigmentation all over my face. That is normal because your melanin pigment is going to increase during pregnancy, and you might get all these. But once you deliver, it's going to be enough. So don't worry about that as well. But moving on to the next topic, like what all should you worry then when you're pregnant and you're through the second trimester? The first thing is when your abdominal pain, it's present continuously, it becomes very frequent, it's bothering you so much, you have regular contractions, definitely you got to approach us. The second is some people, definitely your vaginal discharge is going to increase during pregnancy. This is physiological. But if you have discharge associated with itching or any kind of foul smelling, then definitely you got to approach us. The third is burning nutrition, as I said. You can experience still in this trimester as well. So you got to rule out any infection of the urinary tract. The last is some may have swelling of the legs. You should remember one thing. So, like after you sleep and you wake up in the morning, if your leg swelling is going to subside, it's physiological only. Don't worry about that. But still, you have to get done your BP check and your urine test done to look for any protein excretion, and we have to rule out hypertension. So, get consulted with us. So, what are the supplements now you're going to take apart from your folic acid from the first trimester? You will be given iron and calcium during the second trimester. You should remember one thing: never these two drugs should be taken together. So, you space it apart. And preferably, iron should be taken after your meal. Maybe you can give a gap of 2 to 3 hours after your meal because a content called phytates is present in your meal and that's going to hinder your iron absorption. So you preferably take it a little bit later after your meal. In calcium supplementation, its recommended dose is 1200 milligram per day. You can take it, but your daily requirement will be met with basic food items as well. Like you can, if you feel that you can't take milk, in cheese, in paneer, you have all these calcium supplemented, so you can still take that. Usually, a 2 cup of milk and 2 cup of curd is going to be sufficient to meet your daily requirement of calcium. Okay. So, what are the foods to avoid? As I said previously, the same foods should be avoided throughout the pregnancy as well. Apart from that, some people are very fond of this liver of meat. Definitely, you should not take that very often because it contains vitamin A and that is not good for your baby. And regarding the diet, depending on your BMI, your weight gain, we are going to give you a modified diet. So make sure that you have the appropriate weight gain. And how you can how much you can weight is your BMI will be calculated based on your height and weight. And a normal BMI person can have a weight gain of 10 to 12 kgs in your pregnancy. This is throughout your pregnancy, not in one trimester. This has to be split up as well. But if you are underweight, you can relax a bit. You can have a weight gain of additional 2 kgs, so maximum up to 14 kgs you can gain. But if you're overweight, definitely they're going to cut down your weight gain chart. So that is maximum is 7 to 8 kgs you can gain during your pregnancy. Then your exercise. As I said previously, like your active person, just go ahead with your exercise even in your second trimester. We recommend at least 30 minutes of exercise per day for 5 days. So that contributes to up to 150 minutes of exercise. As I said, your exercise session should definitely include a warm-up session, the exercise part, your strengthening session, then followed by your stretching. So you will not have the muscle cramps once you're done with your exercise. Then your sleep. Definitely you can't sleep on your tummy now, so you got to sleep on your back, but preferably you can sleep to either side. So I would say you can sleep on the left side with a pillow underneath your tummy, not like total 90 degrees to the left side, because that's going to cause numbness on the side you lie down and pain on the opposite side when you wake up in the morning. So you always have a pillow underneath your tummy so that a tilt of 45 degrees is enough for your sleep. And you can fold your legs and keep a pillow between your legs so that this is going to stretch out your backbone and you will not experience that pain when you wake up in the morning. So this is one thing about sleep. And regarding your travel, yes, you can travel during the second trimester as well, but definitely not long distance travel. Then one additional component in your second trimester is your immunization schedule. So the first immunization what you take is tetanus toxoid, that is given between 18 to 20 weeks. And the second one is the Tdap vaccine, that is OP-COP immunization. So the recommendations are it's given from 27th week until 36th week. So you can take this and your baby is going to get immunization as well. So what are the scan you do in a second trimester? So the most important scan in your pregnancy is your anomaly scan or the target scan, which is done at 20 weeks of gestation, 20 to 22 weeks of gestation. So here the sonologist is going to give a certification of the major organs of the baby. She's going to visualize that and she's going to say that everything is good with this baby. So that is more important. Usually, sometimes the static scan can be done with fetal echo as well after a prescription from your doctor. In patients who are diabetes, taking insulin, who are obese, and who have a significant history previously, we're going to advise them to take fetal echo as well. So this is about scan. Then moving on to the blood test. So 20 weeks, we are going to screen you for diabetes. That is called some 5 gram GTT, glucose tolerance test. How you're going to do this is you have to take a blood sample while you fast. Then you will drink 75 grams of glucose. After that, 1 hour later and 2 hours later, you take the blood sample. Values with us. It's not necessarily that if one value is abnormal that you should be labeled diabetes. We still call it as impaired only. So if 2 or more values are abnormal, then definitely you got to consult with us. Then the basic tests like thyroid profile can be repeated, and a urine routine and culture can be done because though you say that you're not symptomatic for infection, there is a terminology called asymptomatic bacteria as well. So it's always better that we check for any urinary infections. So this is about the second trimester. Hope I address the major question that raises in a pregnancy. So one good thing is what you think your baby is going to think the same, and what you eat, the baby is going to have the craving sensation for the same. So always a pregnant mother, think positive, stay happy, eat healthy foods. Even though you don't like it, try to eat as much as balanced diet because your baby going to like the same food what you eat. So don't eat junk foods. Even your baby is going to crave for the junk foods once it grows up. And always take the support of your partner in everything you do. He is the best person who could support you in everything. So if you have any questions, you can just post it now. And done. So we do this live session every week. So you can just get tuned in on our website, and we address all the basic issues every person faces. So you can always get your problems addressed here. If you have any questions, you can always leave it in the comment section. We are going to address everything now. Hope this was useful. So any queries can be posted.